So first up, we are joined by Dr. Zhao Jing. Dr. Zhao specializes in women and child health and chronic disease management. Dr. Zhao will share with us on cervical cancer and the symptoms and risk factors, as well as prevention measures that we can take against this deadly disease. So right now, we're just going to invite Dr. Zhao. Dr. Zhao, welcome.
Hi, everyone. I'm Dr. Zhao Jing from KBL Clinic. Okay, let's start our presentation today. So today I'm going to talk about cervical cancer. I want to pass the message to everyone that no women should die from cervical cancer, because unlike many other types of cancer, we have very good way to prevent and screen cervical cancer. If we can find the cancer early, we can treat effectively. So what is cervical cancer? It is a type of cancer at the cervix. The cervix is the lower part of the uterus, as indicated in the blue circle in the picture here. It connects the uterus to the vagina. It is estimated that in Singapore, every year there are more than 400 women are diagnosed with cervical cancer, and 200 plus die from the disease. So early detection is very important. When we talk about cervical cancer, we must talk about this virus, HPV. HPV stands for human papilloma virus. It has actually more than 100 different strains. About 40 strains can affect the genital area, and we divided them into high-risk strains that may cause cancer and low-risk strains. So high-risk strains may cause cervical cancer, vaginal cancer in women. Less commonly, it may cause anal or penile cancer in men. So low-risk strains, it may cause no symptom at all, or it may lead to genital warts. At this picture shows there are 4 substrains, very important substrains of HPV. The subtype 16 and 18 accounts for about 70% of cervical cancer, and the subtype 6 and 11 accounts for 90% of genital warts. So how is HPV transmitted? It's very common in men and women, actually. It is estimated 8 out of 10 people actually will have the HPV infection in their lifetime. It can be transmitted through the skin-to-skin contact during sex. You may have HPV even it has been years since you were sexually active. And as mentioned earlier, you may don't have any symptom. So our immune system most of the time can clear the virus, usually within 2 years, but sometimes the infection can persist and cause abnormal changes in the cells. So is there any symptom to help us know that we have cervical cancer? It's very important to let everybody know actually early stage cervical cancer has no obvious symptoms. But when the cancer become advanced, you may have symptoms like abnormal vaginal bleeding, such as in between your menses have bleeding, or after intercourse bleeding, or even after menopause bleeding. So there may be change of the vaginal discharge. There may be pain during sex or lower abdominal pain. So what are the risk factors for cervical cancer? The most important one is infection with HPV. Of course, HIV infection, immune suppression status, or history of multiple sexual partners, very early onset of sexual activity, smoking, those are the risk factors as well. Let's have our first poll. When was your last pap smear? Is it within 3 years? B, within 5 years? Or more than 5 years? Or never? You can start the polling. We'll have a look at the result later. So how can we screen for cervical cancer? The answer is pap smear. That is the most effective way to detect the abnormal changes in the cervical cells early. We can do the HPV DNA test together. This will help to identify the high-risk HPV strains. So how is the pap smear done? Like this picture showed, we'll let the patient lie in this position. We'll insert a speculum gently. This will help us visualize the cervix. Then we'll put in the small brush to turn a few rounds. Then we'll transfer the cells to the bottle, sent to lab for testing. This is how we do pap smear. Let's have a look at our first pool result. Is it out? Okay, I have the result. 70% of people choose within 3 years. That's very good. And 30% never. Okay. Right. So who should do the pap smear? According to our Singapore local guideline, all women age 25 and above who have ever had sex should have a pap smear done once in every 3 years for those in their 20s, or once in every 5 years for pap smear with a HPV DNA test together for those 30 years above. Yeah, so from our pool result, actually 70% of women actually did within 3 years. That's very good. So our second pool is about the vaccination. Did you have HPV vaccination before? Yes or no? You can let me know. We'll have a look at the result later. So how to prevent cervical cancer? The most effective way is to get the HPV vaccination. Of course, reduce the number of sexual partners and the frequency of having new partners, using condom. This all help to reduce the risk, but won't eliminate the risk. So let's have a look at the vaccines available in Singapore. There are 3 of them. First, Cervarix. It protects against HPV subtypes 16 and 18. Second is Gardasil 4. It protects against 4 subtypes. Besides the 16 and 18, also protect against 6 and 11. Gardasil 9 protect 9 subtypes of HPV strains, including the 4. Okay, so percentage of cervical cancer caused by subtype 16 and 18 is about 71%, with the cross protection counted is up to 84%. So this number is for Cervarix and Gardasil 4. The number is higher, 90% for Gardasil 9. The percentage of genital wart cases caused by subtype 6 and 11, about 90%. You can see from here, Cervarix doesn't protect from the genital warts, but Gardasil 4 and Gardasil 9 can protect. This is also in line with the indication. So Cervarix is indicated for cervical cancer prevention and also can prevent the precancerous lesions. Gardasil 4 also, on top of the cancer protection, also prevent the genital warts. Gardasil 9, on top of all these indications, also can protect from some type of head and neck cancer. So Gardasil 9 has the widest protection and indication. Approved age for use, Cervarix is only indicated for women aged 9 to 25 years old. Gardasil 4 and 9 can be used in both women and men. Gardasil 4 is for 9 to 26 years old. Gardasil 9 can be used in 9 to 40 years old. So it has the widest age cover also. The vaccination schedule are quite similar for these 3 vaccines, 3 or 2 doses depending on the age. Okay, let's have a look at our second pool. All right. 80% of people didn't have the HPV vaccination. 20% people had the vaccination. Okay, I hope our presentation today can motivate more people to get the vaccine to help yourself from the HPV. Okay, so when we talk about the vaccines, we want to ask 2 important things. One is efficacy, the other one is safety. So HPV vaccines effective? The answer is yes. Here is the data from UK. So UK have been vaccinating the eligible young girls since 2008. And after 8 years, they find the HPV subtype 16 and 18 infection has reduced by 86% in young women, and the precancerous lesion by 71% reduction. So the genital warts diagnosis rate also decreased by 90% in 15 to 17-year-old young girls. And there's also cross protection for boys, about 70%. These numbers are quite significant. So are the vaccines safe? The answer is yes. There are many trials have been done, and probably the most common side effect will be the localized pain, swelling, the redness over the injection site. Sometimes people may have like headache or fever. Rarely people have allergic reaction after the following the vaccination. Some people fainted, but this is very rare. So let's have a look at the third poll. So in that case, who shouldn't get the HPV vaccination? A, people allergic to yeast. B, people allergic to peanut. You can start choosing the answer now. Okay, in clinic, very often people will ask like, how long does the vaccine protect me? So so far the studies has shown the immunity lasts at least 10 years. It can be several decades because now 2020, the vaccine is about 14 years old. So far, among those people who were vaccinated in 2006, the protection does not appear to be waning. So far, there's no evidence to suggest a booster dose, but there's still ongoing studies. So some very frequently asked questions. I have been vaccinated for HPV. Should I still go for cervical cancer screening? The answer is yes. Remember, as mentioned earlier, the protection is quite wide for Gardasil 9, 90%, but it's still not 100%. So you should still go for regular pap smear. Another question, I'm already sexually active. Can I still get the vaccination? The answer is yes. Of course, the vaccine, the benefit from the vaccine are maximized if given before you are sexually active. But the vaccine can still protect you from those HPV subtypes you are not exposed. So there will still be benefits. Next, I'm 30 years old. Can I still get HPV vaccination? Yes, you can still get Gardasil 9. The US FDA have expanded the approved age to up to 45 years old in 2018. Okay, let's have a look at our third pool. Okay, 80% of people choose East. Okay, and the right answer is yeast. This is because yeast is one of the ingredients of the vaccine. So people who have severe allergic reaction to yeast shouldn't get the vaccine. But actually, yeast allergy is not so common. So vast majority of people should still go for the vaccination. Okay. In summary, to fight against cervical cancer, to get Gardasil 9 vaccination early and do pap smear regularly, we can kick the cancer before it kicks you. Thank you. That's all for my presentation.